I learned pulse diagnosis in Chinese medicine school, and at the time it seemed very mysterious. People were able to take pulses and, based on the pulse, tell very specific details about a patient's anatomy and physiology. Chinese doctors have long reported that they can tell whether a woman is pregnant or not simply from the pulse. Is there any validity to this? In a recent study, the results showed changes in blood flow impedance between the uterine artery and the radial artery on the wrist during early pregnancy. And over time, there were changes reflected of the whole uterine blood flow associated with uterine growth. So as the uterus was expanding, it was changing the blood circulation and it was altering the impedance that could be felt on the radial artery. That means there is definitely a correlation between these two. But really, how is this possible? And what is it that we're looking for when we feel the radial pulse? Is it rate and rhythm? Well, yeah, but not primarily. What we're really looking for is pulse quality and pulse position. When we talk about pulse quality, it's the feeling of the pulse itself. Imagine a thick or thin water balloon. Imagine a rubber hose compared to a plastic hose. The softness or hardness of the artery is affected by the relative balance of fibrin and elastin. Gasotransmitters like nitric oxide and hydrogen sulfide not only expand and contract blood vessels and arteries, they also regulate the balance between the collagen and elastin. Gases in the blood cause this vasodilation and also changes in renal filtration. They cause the lungs to expand and contract. They help to mediate the blood-to-brain barrier. So if you're taking a pulse and the blood-to-brain barrier is shut down, it's like having a thumb on a hose, relatively speaking. You open that up and it will change the pulse quality. The gas content will also influence blood viscosity, which is how slippery or thin or thick the blood is. The gases in the blood also exchange within the organs themselves. The nitric oxide, which expands and contracts blood vessels, is also found in specific organs. Traditionally, this was called lung qi or kidney qi. Now they call it lung nitric oxide, kidney hydrogen sulfide. These gases have the ability to expand the organs or contract them, increasing microcirculation around the area or shutting it down. All of this will influence the pulsations in the body as a whole, which can be reflected at the radial artery. Nitric oxide mediates arterial hemodynamics, such as increasing blood circulation to the mesenteric artery. The waveform pulse has been demonstrated to represent changes of important human physiological parameters, such as peripheral vascular resistance and blood viscosity. Blood viscosity, how thick or thin the blood is very important. Imagine syrup versus water. Syrup is more viscous than water, and blood with high blood sugar is more viscous than that which is normalized. Fats and proteins will also make it more sludgy, just as they do with cooking. Fry some fat, sugars, and proteins in a pan, and then let it cool to body temperature. Now imagine this sludge mixed with it, moving through a thin, rubbery tube. You can almost guess what it would feel like if you put your fingers on it. When someone has high blood sugar and a fatty liver, the pulse feels pretty similar to this. This will influence the quality of that pulse. And much of what we're feeling of that pulse quality is the shear stress or the forces of the particles within the plasma bumping up against the tubing itself and this causes its own kind of rhythm or vibration. Plasma viscosity is incredibly important. However, until recently, it's been very difficult to measure. In 1942, plasma viscosity was recommended to substitute erythrocyte sedimentation rates. In rheumatoid arthritis, its sensitivity and specificity are better than that of ESR or C-reactive protein. Plasma fibrogen concentration and plasma viscosity are elevated in unstable angina pectoris and stroke, and their higher values are associated with higher rates of major adverse clinical events. Elevation of plasma viscosity correlates to the progression of coronary and peripheral artery diseases. It should be measured routinely in medical practice. This plasma viscosity is determined by water content and macromolecular components. The effect of protein on plasma viscosity depends on its molecular weight and structure. The less spheroid shape, the higher molecular weight, the higher aggregating capacity, and the higher temperature or pH sensitivity the protein has. And this results in higher plasma viscosity. And this is something we can feel with our fingertips. Now, did ancient people know all of these details? No, but they carefully recorded some of the pulse qualities and passed down for future generations the associated disease states with these pulse qualities. Plasma is a Newtonian fluid. Its viscosity doesn't depend on flow characteristics, and because of this, it's pretty simple to measure. A number of pulse qualities have been documented in ancient Chinese medical texts. These pulse qualities are largely described qualitatively and aren't clearly defined. For instance, the slippery pulse is compared to beads rolling, and the string-like or wiry pulse is compared to a stringed instrument. These may be subjective, but they're describing changes in blood viscosity. And these distinct changes have been found in many disease states such as sickle cell anemia, high blood pressure, and renal failure. Inflammation itself by way of nitric oxide can also influence prostaglandins, which will change the nature of the blood viscosity. They'll cause it to be either thicker or thinner. Chinese herbs, which are said to move blood, invariably work with prostaglandins, particularly PG2. In an attempt to standardize traditional Chinese pulse diagnosis, there's been increased use of Doppler ultrasonic devices to collect wrist pulse signals from patients with gastritis and cholecystitis, as well as using healthy people as controls. So far, these pulse machines have an accuracy rate of around 80%. With pulse diagnosis, there are 3 pulse positions, the cun, guan, and chi, going from most distally to proximal. So by the styloid process, we have the cun, then we have the guan in the middle, and then the chi, which is the most proximal or closest to our heart. The most distal point is said to reflect the upper body. The middle point is said to reflect the mid portion of the body, and the most proximal point, the chi position, is said to reflect the legs and lower body. And then there are also 3 levels or depths. There's fu, floating, zong, and chen, so floating, middle, or sunken. These are called the 3 positions and 9 indicators, and they're generally used for finger reading methods. This gives us an overall idea of how the body is doing. So how is it possible that the radial artery could give this kind of information from the upper, middle, and lower parts of the body? At this point, it sounds really contrived, doesn't it? I mean, it sounds like, yeah, okay, the ancient Chinese had heaven, earth, and people, but does it really make any sense that by feeling these different positions, we could really be understanding the upper, middle, and lower body? The radial artery pressure wave is composed of 3 waves: an incident wave generated by blood flow, and 2 reflected waves, one from the hand region and a later arriving wave from the lower body. This 3-part reverberation gives us a kind of blood-based sonar of microcirculation in the body. It's resonance imaging, similar to an MRI, radar, or echolocation. It's similar to the way Polynesian explorers felt islands in the middle of the Pacific. They would navigate by the stars at night, but during the day, when they came close to an island, they would feel the currents moving the boat. If you can just imagine lying down in a boat, you're feeling a rhythm. And then maybe every 20th or 50th or 500th time they were rocking, they would feel a counterwave coming in the opposite direction. And based on the way that they steered themselves, the reflected wave would increase in frequency until, as they were getting closer to the island, until eventually they could spot it. This is the way the ancient Hawaiians were finding their way across the Pacific, which is extraordinary. Just because you have a low-tech method doesn't mean that it's necessarily not sophisticated. The skill involved in navigating the Pacific by way of this resonance is a similar skill to pulse diagnosis. We can navigate the Pacific today using those traditional techniques if we want to, but if our life is on the line, it's really handy to have GPS. Medicine is also a matter of life and death. And so the more objective we can get these measurements, the better it is for everybody involved. I see really great promise with recent advances in physics, which have allowed engineers to develop methods for predicting the contents of liquids based on their viscosity and the resonance which is coming out of the tubes that they're in. So just imagine that you have some pipes of various sizes and you have water flowing through those pipes. You can imagine the kind of sound that it will make based on the size of those pipes and the rate of flow going through those pipes. Now, what happens when you start to add some sand to the pipes? It'll change the sound coming through them. And now if you imagine adding glass or nails, it will definitely change the kind of sounds that you're hearing, the vibrations which are coming from those tubes. Now what physicists have been able to do is develop sophisticated methods for listening to very accurately predict what kind of fluids and what content of those fluids is traveling through these pipes. So it goes beyond blood viscosity to really predict, is the sound of that, is the feeling of that, is the vibration coming off of that because of proteins? Is it because of damaged blood vessels? Is it damaged blood cells? Are there areas of platelet adhesion? This is something that they'll be able to tell. This truly requires a systems biology way of looking at the body, because it's not just blood that's flowing through. There are blood and there are gases and there are forms of life. There are bacterial profiles, there are biofilms, there is arterial plaque, and all of this is an ecosystem. So as we take the pulse, we're trying to look at the entirety of the ecosystem and the resonance or sound that it's making. Thank you so much for listening to the Botanical Biohacking Podcast. I hope you enjoyed this. I know I did. I'm your host, Dr. Andrew Miles.